Carbamazepine is a medicine used for seizures, nerve pain, and even mood problems. But have you ever wondered what it actually does inside your body? In this video, I'll break down the 7 biggest effects of carbamazepine in very simple words, so you can understand how it works and why doctors prescribe it. Carbamazepine is a well-known medicine used around the world. Doctors use it to treat seizures, severe nerve pain, and bipolar disorder. It works by calming down the brain's overactive electrical signals, which helps reduce sudden attacks and stabilizes the nerves. Carbamazepine acts slowly, but once it starts working, it stays active in the body for many hours. This makes it a strong and reliable option for people dealing with nerve-related conditions. Effect number 1. Controls seizures. Carbamazepine's most powerful and life-changing effect is its ability to control seizures. When someone has epilepsy, the brain's electrical activity becomes too fast, too loud, and too chaotic. It's like the brain's wires keep sending sparks at the wrong time. Carbamazepine steps in and stabilizes those electrical signals. It slows them down, smooths them out, and prevents sudden bursts that can trigger a seizure. Many people who use this medicine notice that their seizures become less frequent, less intense, or sometimes stop completely. What makes carbamazepine special is that it doesn't work for just a few hours. Its effect lasts long and steady, making it a strong option for long-term control. For many patients, this medicine becomes a daily part of life, giving them stability, confidence, and a sense of normal routine. Because seizure disorders can be unpredictable and frightening, having a medicine that gently calms the brain every single day can feel like getting freedom back. That's why doctors trust carbamazepine as a long-term treatment for epilepsy. It doesn't cure the condition, but it controls the electrical storms inside the brain and helps protect people from sudden dangerous episodes. Effect number 2. Reduces nerve pain. Carbamazepine is famous for one more major effect: reducing severe nerve pain, especially in conditions like trigeminal neuralgia. This type of pain isn't normal pain. It feels like electric shocks, stabbing currents, or burning sensations shooting across the face or body. Regular painkillers simply cannot control this type of nerve pain because the problem comes from overactive nerves firing repeatedly. Carbamazepine works deeply on those nerves, calming them down and slowing the abnormal signals. People who take it often notice that the painful attacks become shorter, less intense, and less frequent. For someone living with trigeminal neuralgia, even one day without those electric shock attacks feels like a blessing. Carbamazepine gives many people that calm. It acts like a shield over the irritated nerve, preventing it from sending non-stop pain messages to the brain. That's why doctors often choose this medicine before any other treatment for nerve pain. It works better than most common painkillers because it fixes the real problem, the misfiring nerve, rather than just dulling the sensation. For many patients, carbamazepine gives a sense of control and relief they never thought possible. Effect number 3. Stabilizes mood. Another powerful effect of carbamazepine is its ability to stabilize mood, especially in people with bipolar disorder. Bipolar mood swings can be unpredictable. One moment, a person may feel extremely high, full of energy, talking fast, unable to sleep. And then suddenly, they can fall into deep sadness or emotional exhaustion. These swings affect work, family, and everyday life. Carbamazepine helps by calming down the electrical activity in the brain that causes those emotional extremes. It smooths the mood out and reduces the number of manic episodes. Over time, many people feel more stable, more steady, and more in control of their emotions. It doesn't make someone numb or emotionless. It simply helps the brain maintain balance. People often describe it as finally feeling normal again, after months or years of living with unpredictable mood changes. Because bipolar disorder is a long-term condition, having a medicine that maintains stability day after day is extremely important. Carbamazepine gives people that long-term safety and helps prevent emotional episodes before they even start. This effect often becomes one of the biggest reasons doctors choose this medication for mood disorders. Effect number 4, makes you sleepy or drowsy. One of the most noticeable effects of carbamazepine is drowsiness. Many people feel extra sleepy, heavy, or mentally slow, especially in the first few weeks of treatment. This happens because the medicine slows down the brain's electrical firing to control seizures and nerve pain, and that calming effect can spread to other parts of the brain too. It's almost like the brain goes into quiet mode. People often describe feeling relaxed, calm, and even a bit foggy. Concentration may drop, reaction time becomes slower, and some people feel like they want a nap during the day. While this effect can be annoying, it usually improves as the body gets used to the medicine. The brain slowly adjusts to the new level of activity, and energy levels begin to return. But in the beginning, it's common to feel tired or less alert. This is why doctors often tell patients to be cautious with driving or operating heavy machines when starting carbamazepine. The drowsiness is not dangerous. It's just the brain adapting to its new rhythm. Over time, most people feel normal again, but the sleepy feeling is often one of the first things they notice. Effect number 5, affects blood level. Carbamazepine can also affect important blood levels in the body, and this is one of the effects people must take seriously. The medicine can lower sodium levels, leading to a condition called hyponatremia. When sodium drops too much, people may feel confused, tired, weak, or may get headaches. In severe cases, it can cause dizziness or difficulty thinking. Another effect, although rare, is its impact on white blood cells. These cells protect the body from infection. If carbamazepine lowers them too much, the body becomes more vulnerable to illnesses. That's why doctors often schedule regular blood tests for anyone taking this medicine, especially in the early months. These tests help detect problems early before symptoms appear. It's not that the medicine is unsafe. It's just powerful, and the body reacts to it in different ways. Most people never experience serious blood issues, but monitoring is an important part of staying safe. This effect is one reason carbamazepine must always be taken under medical supervision, not casually or without follow-up. When used properly, the benefits outweigh the risks, but awareness of blood changes is important for long-term health. Effect number 6, alters liver function. Because the liver is responsible for breaking down carbamazepine, the medicine can affect liver function over time. The liver works hard to process every dose, and sometimes the activity increases stress on liver cells. This may lead to a rise in liver enzymes, which is usually painless, but can be seen on a blood test. Most people never feel anything, and the changes are mild. But in rare cases, the liver can become irritated or inflamed. This is why doctors recommend periodic liver tests for anyone taking carbamazepine long-term. The goal is simple: catch any small issue before it becomes big. The medicine itself is not harmful to everyone, but because it is strong, the liver needs to stay healthy to handle it. If the liver becomes overwhelmed, it can lead to symptoms like yellowish skin, dark urine, or stomach pain. But again, these effects are extremely rare. The important part is monitoring. When tests are checked regularly, carbamazepine remains a safe and effective medicine. It's all about balance. The medicine offers big benefits, and responsible monitoring keeps the liver protected. Effect number 7, interacts with many other medicines. Carbamazepine has a strong effect on the liver's enzymes, and this causes it to interact with many other medicines. It speeds up how quickly the liver removes drugs from the body. This means other medicines may become weaker or stop working effectively when taken together. This includes things like painkillers, some antibiotics, antidepressants, and even birth control pills. For example, if a woman is using birth control pills, carbamazepine may reduce their effect, increasing the chance of pregnancy. These interactions don't mean carbamazepine is dangerous. It simply means it is powerful, and the liver reacts strongly to it. That's why doctors always ask about every medicine, supplement, and even herbal product a person is taking. A simple combination can change how carbamazepine works or affect the other medicine. For safety, it's important to inform your doctor before starting anything new. With the right guidance, carbamazepine can be used safely without problems. But understanding how it interacts with other medications is one of the key things people must know before starting treatment. Carbamazepine can also cause a few common side effects, especially when someone first starts taking it. Many people feel dizzy or lightheaded, and some notice that their vision becomes slightly blurred for a short time. Walking may feel unsteady, like the body is adjusting to a new balance. A few people experience nausea or a mild upset stomach, while others notice a dry mouth throughout the day. These side effects usually appear in the beginning as the brain and body adapt to the medicine. The good news is that for most people, these symptoms slowly fade away within days or weeks, and the body begins to feel normal again. They are usually temporary and not dangerous, but they are important to know so that nothing feels surprising in the first few days of treatment. Carbamazepine is powerful, so some people need to be more cautious before taking it. Pregnant women should be careful because the medicine can affect the developing baby. Elderly people also require extra monitoring, as they are more sensitive to dizziness and blood changes. People with existing liver problems need close supervision because the liver processes the medicine and can become stressed. Anyone with low sodium levels should also be cautious, since carbamazepine can lower sodium even more. And people who take multiple medicines must be careful because carbamazepine interacts with many drugs. This doesn't mean they cannot use it. It simply means they need more medical guidance and regular checkups to stay safe. To recap the 7 major effects of carbamazepine: it helps control seizures, reduces nerve pain, stabilizes mood, and often causes drowsiness in the beginning. It can affect blood levels, place some stress on the liver, and interact with many other medicines. Carbamazepine is a strong and effective treatment for many conditions, but it should always be used with proper medical supervision. When taken responsibly, it becomes a reliable and life-changing medicine for many people around the world.